My dad was a doctor in rural Georgia, so he was out where there was nothing basically, and 30, 40 years ago I was watching some of the surgeries that he did, and I was thinking, oh, that's cool, that's what I want to do. I grew up part of the time in Virginia. As a teenager, my grandfather was up there, and he would take me out fishing a lot as a boy, and so that was my favorite pastime. I spent 4 years in Texas training residents and doing head and neck surgery and facial plastic surgery. Then I figured out that I'd like to go to a place where there's good fishing, which is the reason why I moved here. But you know, when you have your own private practice, you have a certain amount of volume, and you could do a fair amount of surgery with that, you know, just like everybody else. But you know, lifestyle left afforded me the opportunity to do even more. I mean, the amount of procedures that I do and the skill level that I attain is probably 3 or 4 times as much as anybody gets in private practice. I mean, you can do the math, but it's, you know, hundreds, if not approaching 1,000, I don't know, but several hundred in a year anyway, easily. And obviously, you know, repetition breeds expertise. My plan for each patient that comes in is to do the best job I can possibly do. I don't worry about, you know, anything else that's going on or how long it's going to take or if anybody else is waiting, but more specifically, you know, how am I going to get the best surgery that I can for that patient? And if I keep that in mind each time that I sit down at the table to do a surgery, then I expect to get the best outcome that you can possibly have. Because that's my goal, and I don't worry about anything else.